Let's talk about the different techniques of breast augmentation and my preferred technique. Techniques of breast augmentation can be classified according to the incision, or where we make the cut to put the implant in, as well as the pocket or the space in which the implant sits. So let's talk about the incision type. Now, I've done incisions both around the nipple, in the breast crease, and through the armpit as well, but these days I almost always go through the breast crease because this has been shown to have the least degree of bacterial contamination and therefore the least risk of capsular contracture, and the scar always fades away very well and it's always hidden in the breast crease. Whereas if you do it around the nipple, there's a little bit more bacterial contamination risk there, and if you develop a bad scar, it's very visible just around the nipple. So my preferred incision site is the inframammary fold or the breast crease, and it's usually around 4 to 5 centimeters depending on the size of the implant that we're putting in. Now, in terms of the implant pocket, there is the option or choice of putting the implant above the muscle, below the muscle, or somewhere in between, where part of the implant is covered by the muscle and part of the implant is covered by the breast tissue. That is called a dual plane pocket, and that is my preferred pocket when it comes to breast augmentation, where we release the muscle to open up the space for the implant to be accommodated, and the top of the implant is covered by muscle, where you get a little bit more coverage for long-term protection of the implant, and the bottom half of the implant is devoid of muscle coverage but covered by the breast tissue, so it can show off the natural curvature of the lower part of the breast.